Good afternoon, respected panelists and delegates. I am going to present my paper titled Impact of Simulator-Based Learning on Cataract Surgery Training of Ophthalmology Postgraduates. I have no financial disclosures. So cataract surgery is one of the most commonly performed, technically demanding surgeries, and it requires consistent training. So we all know that simulation-based learning started with aviation, and now it has been increasingly integrated in medical education, and in recent years even in ophthalmology training it has been integrated. But there is little research on what trainees think, what is their perception and what is their expectation out of the simulator training. So if we see traditional training, it is training on patients, so it's a hands-on in live surgical settings it occurs, where patient safety is a concern, because the naive or the neophyte surgeons, they are training directly on the patients, they are practically learning the surgery on patients. So there is limited opportunities for skill refinement. There's also the feedback that they get is from their mentors by and large. So it depends on who is training them, and also there is non-uniformity in training across centers. So if a resident is training in a high volume center, he gets more hands-on cases. If he's training in a center where the hands-on experience is less, his training would lack. When we compare this to a simulator-based training, here there is training that occurs in a safe and controlled environment. So it is an immersive experience. It is a machine that teaches you, and this environment is reproducible. So it is learner-centric. So if a student commits mistakes, it is in a safe environment. He gets the opportunity to repeat the step in that same environment and improve. So he can do it repetitively in a immersive and safe environment. He or she can practice intricate movements, he can acquire technical proficiency, and he also gets feedback based on data-driven metrics. So not only does he train in steps of the surgery, but also it helps to develop hand-eye coordination, depth perception, and also tremor control, which is very important for microsurgery like cataract surgery. And also, it helps to develop the surgical decision making and in building confidence. So learning is largely defined by goals and what experience the learner has. So if the learner has a complication, his confidence really it is like a setback to him, and also it is harmful for the patients, and it also jeopardizes the trust that the patient has for the doctor. And it is also seen that when a student is prepared with the simulation, his surgical time also decreases in the OR when he's doing his case. So the virtual reality platform that we have at our center, it is from the IC Magic. So it has an OR machine interface, which is just like the what the surgeon will see in the OT, and then it has 2-axis phaco pedal, and it is validated. And evaluation can be done by the trainer also online. So it helps to develop basic microsurgical skills, steps of cataract surgery, and also advanced modules are present, like how to do surgery in floppy iris, weakened zonules, PCR, how to put a CTR, iris expansion ring. So it has the trainee can progress through all these steps. So our aim was to analyze the overall experience, benefits, and challenges of simulated training on cataract surgery of postgraduate residents at 2 tertiary eye care hospitals in North India. So we took the postgraduate students who were undergoing this training on the ICVR Magic at 2 government hospitals. So we distributed an online semi-structured questionnaire which had 26 closed-end questions, and the questions had a neutral tone, and they were asked in some questions to grade their experience on Likert scale. So 54% respondents were in the PG year 2, 61.9% were females, and majority of the residents were in the 25 to 30 age group. They had, before simulated, they had done less than 10 surgeries in the OR, and they were getting approximately 1 to 3 hours of training per month on the simulator. And 73% of residents found it to be inadequate. And the main barrier was that they were busy, the training was happening in the busy clinical work, so they could not get sufficient time to practice. Capsulorhexis and nucleus sculpting and chopping were the most common steps, and they found maximum benefit in improving capsulorhexis skills, whereas nucleus chopping was difficult for them. It additionally 66% said that it benefited their hand-eye coordination, depth perception, and hand tremors and instrument handling. And approximately most of the responses were like it helped them moderately. So we did not get very marked improvement or no improvement in these. And very interestingly, 92.9% said that it improves their confidence and anxiety. And 78.6% students felt that actual surgery and simulation surgery that they were doing were quite close. And 76% said it helped in reductions in complications. And when they were asked, if compared to goat's eye training, 54% said that they improved and they would recommend it to their juniors. So this is just the small video, and I'll skip through this.
Kindly wind up, please.
Yeah. And so the conclusions of our study was that most residents found simulator training useful for surgical skill development and for building their confidence in a safe environment. It's a promising teaching methods which will eventually benefit the patients, and it mandates surgical simulation to be inbuilt in residency training program. And the study confirms the feasibility and positive impact of simulator surgical training, the only limitation being the high cost of the simulator. Thank you. These are my references.
Thank you so much. A nice talk, and this is probably the need of the hour, and it is for patient benefit. Of course, the cost is the factor, as you said. Thank you so much.